Monday. In the past, getting dental implants could mean sitting through hours of painful procedures. Today, you can get a brand new smile without that kind of worry. Here to explain, welcome back oral implantologist Dr. Farid Noie, along with his patient, Linda McCarthy. Hello. All right, Dr. Noie, when we say implantologist, we know what a dentist is, but this is a whole nother level of education dealing with the teeth.
Yes, you're right. Oral implantologist is a dental surgeon who is fully trained in both placement and restoration of the dental implants, starting from regenerating the bone that is lost and the tissue to placing the implants surgically and then restoring it later to make it just like a tooth.
Yeah, and you're saying not only is the tooth natural looking, but the bite has to feel natural, be right for the whole face.
And it has to feel just right.
Yeah.
See, right. And in the beginning, our field wasn't really ready for it. And we had to do, different multiple visits, multiple doctors. Everybody had different specialty. But an oral implantologist is somebody who follows through from the start to finish, creating, the procedure and staying with the patient, keeping the bond with the patient, and also later on, if something does happen, we all know how to go ahead and fix that problem.
Now, there are a lot of reasons why people could lose their teeth, and we're looking at an example of people who've had either a few teeth missing, several teeth missing, and how they can be restored, but lots of reasons why people could lose their teeth.
Yes, absolutely. Teeth can be lost congenitally. Some people are just born without permanent teeth, or you can lose your teeth due to some kind of genetic plays a huge role. Accidents and some diseases that we're going to talk about, and also bull riding does excellent. It's an excellent way to lose your teeth.
That bull riding thing right there. All right, so maybe I won't do it. Linda, for you, it was a disease that you were diagnosed with, an autoimmune disease that started taking a toll on several parts of your body and your teeth.
Yes, Deborah. A few years ago, I was diagnosed with scleroderma. And scleroderma is an illness that is triggered with the autoimmune system attacking the collagen in a person's body. And in my case, it has attacked my lower back and my upper mandible. A few years ago, a little over 3 years ago, over the holiday time, I had 2 teeth come loose and come out, my 2 front teeth. And of course, a panic set in. I had to find a solution. I interviewed many doctors. They did not want to take this on because it was a major redo.
Yeah.
I found Dr. Noie. He was compassionate enough to take on this difficult situation. He literally took bone from my chin, transplanted it to the upper mandible, grew brand new bone, stronger than ever. We had a couple of setbacks. It's taken a period of a couple of years, but we are here, and I am smiling once again.
Look at that smile. Look at that smile. And you say smiling once again. You have been a model for a while, and so you knew kind of that beauty world. But even for people who aren't models, the thing is, if you can't smile, you don't feel comfortable smiling, it really impacts your entire, psyche. And Dr. Noie, you love taking a patient who says, look at me, what am I going to do? And then turning them into the mirror when they see their brand new teeth.
Oh, that's the best. That's the best reward right by itself. I mean, when you can actually, now we are to a point that we can actually get somebody who, used to in the beginning, when the patient didn't have enough bone. But once you lose the tooth, unfortunately the bone also goes with it because there's no need for it anymore.
Yeah.
And we used to didn't know what to do with it. Now we have actually learned to grow bone. So once you can.
So it's something to affix it to.
Exactly. So we can actually fix it from start to finish, no matter how bad it is. And I love those challenges.
Now, hers took a little while because there are several things you had to do.
Right.
But for most people, the evolution of dental implants has come so far. Because, as I mentioned in the introduction, that oftentimes there's a bunch of painful procedures and trying to fit this, fit that. You can do this in a much shorter time than in past.
Well, now we have, we have got it to a point that actually somebody can come into our office without any teeth, wearing dentures for years. You come in the morning, we place some teeth in there for you. While you're fully asleep, you don't remember being there. We place the teeth for you.
You go to sleep with 3 teeth and wake up with all of them. I love that.
Exactly, and then go home that night and eat a nice dinner.
Yeah, and that's the thing, is that these are, in fact, they're better than real teeth because they're usually stronger. They're perfectly placed in your mouth.
And they don't need root canals.
And they don't need, so she can never get a cavity in any of these.
They're a titanium. They're pure titanium, so nothing happens to them.
Wow. Do they just color when you're drinking the wine, the red wine?
Well, that's the best part. The red wine does not stain dental implants. So we're good to go.
Yeah. And this is the thing. Did you consider dentures at one time, or did you immediately pass go
Some
and just go
removal,
straight to?
You know,
implants?
Deborah, I wasn't even a candidate for dentures.
Oh, that's
You're
'cause you
missing
needed the
your
bone. Yeah.
Yeah, you
There's
cannot have
nothing
that
there.
placement. I was looking at something they call a flipper or a bridge for the rest of my life, and it just wasn't acceptable. I am incredibly grateful that due to a disease taking my teeth, and many cancer victims are faced with this.
Right.
You know, I want to let people know that they are not without hope. And especially the people that are afflicted with scleroderma, you don't know where this thing is coming up, and let them know that there is hope to have a normal, beautiful smile again.
Yeah.
Absolutely.
And I want to touch on something she said, that there are a lot of doctors who would not take her case because I guess they were afraid of complications and the whole
Yes,
bit.
yes.
Why did you decide to do this anyway?
Because if it's not challenging, it's not worth doing. You have to enjoy, you have to kind of challenge yourself, and somebody needs to take care of. I mean, there are some of my colleagues who are not comfortable with patients who smoke. I'll say, well, it's not good to smoke, obviously. It's not good for you. But if you do, somebody got to fix you. Those are the ones who need me the most. So why
we'll work it out.
You can't pick and choose the cases you want. You have to go with the one that actually can benefit the patient the most.
And of course, this is the end result that you
and
get
that's
right here.
exactly, and the rewards are just amazing. It just really does.
Yeah, and you can do either one tooth
Yes.
or several teeth, whatever you need.
And you know, and a lot of people, actually, I'm glad Linda is here. A lot of people, there's a stigma attached to losing teeth. People think you lose your teeth because
Well, they make judgments about you. You don't take care of yourself.
Exactly,
Yeah.
and that's so not true.
No.
I mean, you know, exactly. You know, a good trip to rodeo can definitely.
Yeah, get rid of your teeth. Yeah. Even though you've not missed a single dental appointment. All right. If you'd like more information on Dr. Noie's services, you can call 281-332-4700, 281-332-4700, or log on to drnoie.com. Who knows? You could have a full set of teeth before rodeo's over. All right. We've heard that medical conditions like high blood